Welcome everyone. Let's just gonna give it a couple minutes here for people to join. All right, let's get started. Welcome everyone. We're so glad you're here. Um, I'd like to quickly just review a couple of housekeeping items. We'd like to remind everyone of our commitment to maintaining a safe and accountable space. If you're experiencing issues or need assistance, please reach out to me by sending me a DM. To walk you through the tools in this session, I'd like to draw your attention to the vertical bar featuring several icons on the right side of your screen. If your event feed is open, it's going to be hiding your vertical bar. So please close your event feed by clicking on the X in the upper right corner of the event feed box. Once you've closed your event feed, you'll be able to see a vertical bar with several icons. You'll see speech bubbles, that's the chat box for this session, the Q&A icon, an icon of people indicating the participants in this session. The next to the last icon on the vertical bar looks like a checklist, and that's the participation survey that we ask you fill out after this session. We encourage you to click on that and complete it before leaving. The final icon looks like a puzzle piece that will toggle your closed captioning on and off. To enable us to keep up with the questions, we ask that you please only use the Q&A icon to share your questions with the speakers. Again, it's the third icon from the top with the Q&A on it on the vertical bar. And it's now my pleasure to introduce you to our speakers for this session. We have Dianara Ruiz, Sydney McKinney, and Samantha Gills. Thank you, and the stage is yours.
Thank you, Robin. I'm going to go ahead and share my screen. All right. Well, thank you everybody for attending and for having us. My name is Diana Ruiz. I am a policy associate at the Children's Partnership, and I will let Sydney introduce herself.
Hi, everyone. I am Sydney McKinney, and I am the Executive Director of the National Black Women's Justice Institute. Very excited to be here with you guys today.
And lastly, but certainly not least, Samantha, I will let you introduce yourself.
Yeah, so hi, my name is Samantha Giles, and I had the honor of working with both Sydney and Dianara with this project, and I'm looking forward to speaking with you today.
All right, thank you. And we will get started. So our presentation today is on youth-centered mental health strategies for hope, healing, and health. A little bit about who we are. So I am a part of the Children's Partnership, and the Children's Partnership is a California statewide advocacy organization that works to advance children's health equity through research, policy, and community engagement.
Hi, and I just introduced myself. I'm Sydney McKinney, the Executive Director of the National Black Women's Justice Institute, which is a Black women-led nonprofit that is leading rigorous research, capacity building, and policy advocacy to transform the criminal legal system, and doing so by elevating the voices, experiences, and leadership of directly impacted Black women and girls. I'm very excited to be here.
For today's agenda, we will be setting the stage as to what is the Hope, Healing, and Health Collective. It is our youth-led policy council. We'll have an overview of the policy recommendations that actually came out of our H3 collective, and we will have our youth leader, Samantha, share on her experience and reflections on advocacy and her time working with us.
So I'm going to kick us off by setting the stage. We are really proud of this work because I think not only of the policy agenda that we produced, but the number of partners and young people we had the opportunity to co-create the policy agenda with. You'll see on this slide that there were 15 organizations that we identified coming from all across the country. Samantha, I think, is in Virginia. We had folks, young people in Oregon and California and Detroit, Chicago. And so you can see on this slide the different organizations we partnered with. As part of this work, it was really important to us that we identify organizations that were both really committed to the mental health and wellness of young people of color, and also really committed to organizing young people and supporting their leadership and advocacy. So as part of that work, we identified 15 organizations that also in turn identified 15 young people who formed our youth council. And over the course of, oh goodness, I forget how many months it was, we worked together to create this policy agenda, having monthly workshops with young people, talking about mental health and how it impacts them and their peers. And we even engaged in, and they led, a listening sessions that included, I think, over 40 participants, people that they knew, people who were their peers, and each of our youth leaders facilitated these listening sessions. And out of the listening sessions that we hosted, we developed the policy agenda priorities that Diana will share with you. Oh, sorry, I'm supposed to say this too. So the policy priorities are access to services, experiences, getting support. These were some of the challenges that they identified. Access to services, experiences, getting support, barriers, fear, and stigma, role of schools, the way in which non-clinical supports can support really advance the health and wellness, mental health and wellness of young people, as well as the way in which family and culture impact access to mental health services. Those were the themes that really emerged from the conversations that we had and that they identified, and the policy agenda really is in response to that, figuring out how we can address these barriers to make access to mental health services equitable and responsive to the needs of BIPOC youth.
So now I'll go over some of the many policy recommendations that came out of our conversation. So access to quality care, the barriers that our youth identified was 1, a lack of diversity among mental health professionals, 2, high cost of quality services, and 3, the limited uptake of virtual services. And then from these barriers came, okay, well, what can we do? And one of the policy solutions is to increase the number of therapists and counselors and other supportive adults that reflect the different races, cultures, and communities that all of these youth are coming from. BIPOC youth have different challenges in their life when you compare them to their white counterparts, and they want to be able to talk to someone that understands them, that looks like them, that has had similar life experiences. The high cost of quality services, with that part of it, youth want to continue learning and growing, and they want an increase in access to and knowledge of mental health insurance and benefits. They want to be knowledgeable. They want to know what they're covered for, what they can do. They also want to ensure that youth can access all of these services that are entitled to them with confidential care. So that means without having to go through parent consent or notification. Some youth had personal experiences that they didn't want their parents to know. Some, especially when we were talking to LGBTQ plus youth. So another policy solution for this barrier that we had was to ensure that youth both have in-person and telehealth options both available to them depending on their needs and their preferences. We spoke to a few of them. Some of them had access to one but not the other, and they they want to be able to access all of them, depending on what they need. And then lastly, they would like to lower, one of our policy solutions is to lower the cost of mental health services for youth and their families. Mental health services and supports tend to be very costly. And in order to get a better uptake on services, we should also decrease the cost of them. For our second bucket, the scope of available mental health services. Two barriers that our youth identified was one, that culture, well, it's not really a barrier, but it was something that they identified, culture as a healing intervention. But the barrier is that there really isn't a lot of mental health services or supports or therapeutic activities that actually encompass culture as a whole. So the solution is to expand what public and private youth serving systems consider to be the scope of mental health services, to include promotion of racial and ethnic affinity practices, rituals, and civic engagement for youth from historically marginalized communities. We had a lot of positive feedback from our youth saying how being involved in a youth-led policy council and advocacy, how that was supporting their mental health. We've had youth saying that being able to just learn about their history and learn about their culture helps them as well and is a therapeutic setting. Another barrier was that there is an over-reliance on clinical mental health modalities. Building on to what I previously said, we also want to build the capacity of youth peer leaders to be able to provide culturally responsive and gender-affirming peer support, mental health education, and wellness promotion. Our youth are very knowledgeable, and our youth are also supporting their peers. So we want to be able to give them the tools that they need to be peer support leaders and be peer certified, to have these conversations that they're already having with their peers. For our bucket on family, race, and culture, one of the barriers that they identified was stigma and the lack of community and family awareness. We suggested to create policies that ensure that BIPOC youth and their families receive care and treatment rather than surveillance and discipline in response to their distress. We know that historically marginalized communities and BIPOC communities have more surveillance and discipline when they're having mental health crises rather than having supportive, caring care. Another barrier was the unmet mental health needs of family and household members. So we know that generational trauma is a thing, and that does impact not just the youth, but it is a cycle. And our youth said that they also wanted their parents to have some of these services and these supports. That what they were advocating for, it wasn't just for them, it was for their families. So one of the policy solutions is to create and maintain safe spaces for all youth, particularly girls, transgender youth, and youth with immigration status concerns. In addition to another solution is to reduce the impact of family and cultural stigma by investing in family engagement and community education on mental health needs of young people. A lot of our youth would love to have these conversations with their parents. Some are fortunate that they can, but others know that the education that they're getting on mental health is something that needs to be shared with the rest of their community. And lastly, one of the barriers is the warranted mistrust of the mental health system. And our policy solution is to ensure that whole families and households receive adequate and culturally responsive mental health care. This bucket really is centered around family, race, and culture, and making sure that not just the youth, not just children and youth, but that their entire family is heard and taken care of and receives the education that they need, but also the services, and in a way that they feel safe and heard. Our last two buckets are school-based services and youth engagement. So for school-based services, the barrier that was identified is that there's a lack of sufficient school resources staffs and programs on school campuses. And the policy solution would be to increase staff capacity, administrative, programmatic, clinical, and non-clinical on school sites to meet the growing needs of students, especially in the communities where there is poor healthcare access. For youth engagement, our last bucket, the barrier was that youth are not engaged in co-creating programs, interventions, and community conditions that support their well-being. Youth are rarely at the table when when policy solutions are coming up for youth mental health crisis. They're rarely at the table when there's talking about programs that would benefit them. And really, we want them at the table. So our solution is to continue, our policy solution is to engage school-aged youth, especially those from marginalized communities, in community and school need, for marginalized communities, in community school needs assessments and program development, implementation, policymaking, and all of those things that are surrounding their mental health and their well-being. These are very knowledgeable, and they know what they need better than we know what they need. So they need a seat at the table, and it's best to engage them early, engage them in all of the programs that they could be engaged in. And they're also very happy to be involved. I think that was something that also came out of our listening sessions. The engagement that we had, they're all very excited to be able to have a seat at the table and to talk about some of the solutions that they know would work, not just for them, but for their peers. And now I will pass it off to Samantha Giles, who is one of our excellent Youth Policy Council leaders. She was on the Hope Healing and Health Collective, worked with us for about 8-9 months. She is one of the voices behind most of everything that was highlighted, voices behind the policy solutions, and there's no other person to be able to explain what it was like to be in the Hope Healing and Health Collective than Samantha. So Samantha, I will pass it on to you.
Thank you, Dayanara. For me, I was selected through Black Girls Smile, which is a nonprofit basically advocating for Black women's mental health and wellness as well. So then the director of Black Girls Smile basically mentioned this opportunity, being able to be immersed in a community with other BIPOC youth. And I thought it was very intriguing because I come from a PWI. So this was one of the rare times I was going to be, I guess, fully encapsulated with other BIPOC youth around my age, talking about something I'm very passionate about, which is mental health and mental health reform. And basically, through this opportunity, we were able to really connect with one another and just talk about ways to improve mental health, but really specifically targeting culturally responsive and gender reaffirming mental health care. And basically, with that, we were able to invite people from our communities into our spaces, and we had a listening session. We had detailed notes, just really like learning from each other, but also talking not over each other, but with each other and sharing our experiences of mental health or lack thereof of mental health care. And what I'm very proud of is to, publish the research paper and publish the policy report. And I think that just shows like a physical accomplishment we were able to do within those 8 to 9 months. And I'm very grateful to have the opportunity because I'm very passionate about mental health as well.
Thank you, Samantha.
Yeah, thank you so much, Samantha. I just want to really echo, I think, how important it was for us to bring together young people to really lead this work. And it was really inspiring to watch you all really lead us through these tough conversations and support each other in having these conversations. I think that was one of the most inspiring things to watch, is to see you all really encourage people. I think you in particular encourage people to be vulnerable in this space, which I think is really a testament to the kind of community we were trying to form, and really what we were able to accomplish by being in this space together, really taking on these tough questions and supporting each other as far as where we go from here. So thank you. So the action steps that really came out of the learning that we did together through this project were identified by the young people. We actually invited CLASP to join us and provide and offer a training for our young people around what is policy advocacy and what are the different forms that it can take and how can you do this. And so they really walked through the different styles and approaches. And out of this, the 6 action steps that you see before you are what our young folks, the youth leaders, identified. So first, they wanted to, thought it was important for us to be thinking about and investing in capacity building around advocacy, and particularly for young people from marginalized communities, feeling it was really important for them to get the training and the coaching and mentoring to be successful advocates in their schools and their communities, and to be able to really partner with each other as far as really having the skill set necessary to do this work. The next thing that they thought, which is a natural kind of extension, is we really need to focus on community organizing that really focuses on young people, focuses on building relationships between youth and adults, but really wanting to make sure that young people are out front, are the voices, are the leaders, they are the experts, and that they are the ones who are leading the charge to bring people along. And I think, that was really, really important. And I know based on some of the surveys that we completed that young people who participated in the H3 collective felt like they were better able to engage in advocacy, continued advocacy in mental health, as well as in other spheres of their life. And on a personal scale, as well on a grander, more macro level scale, what's happening in their schools and what's happening in their communities. They also thought it was important for our advocacy strategies to include public awareness and increasing people's knowledge and understanding of the mental health needs of youth of color, and also being able to create spaces and opportunities for young people to provide their feedback about how existing mental health resources are working for them or not, and so that people really understand what is the state of young people's mental health and what do we need to do to address it. So thinking about the ways in which we could have public education campaigns and really get that information out to the general public, as well as targeting influencers, and not just the Beyoncés or the Megan Thee Stallions, right? But really young people themselves, I think, are influencers, and being able to find those trusted messengers within their communities, help them better understand the way that mental health impacts young people of color, and really give them the tools to continue on these conversations and help increase awareness and visibility of these issues, in order to, as I'm going through this, how beautifully these all run together, really help to change people's attitudes and beliefs. What do we need to be focusing on? How, we live in a country where I think increasingly now people are talking about mental health, but once upon a time that wasn't the case. And so there's still a lot of work to be done to really get folks to understand what mental health is, what it means to be mentally and emotionally well. What are their beliefs about the mental health system, some of which are true, and some of which are problematic, and how do we also change that? So really, what's the dialogue that we can be creating around mental health and wellness that's going to impact the attitudes and beliefs of folks, and really begin to shift policy recommendations and what policy is actually enacted to support the wellness of youth of color. And again, like I said, political will, all of this, really naturally leads into this by building folks' capacity, by doing the organizing and the public education, finding our trusted messengers, and beginning that work to change people's attitudes and beliefs. We reach this point where we can really shift political will and support, where we can identify political leaders who can actually recommend these policy changes and that we have identified in the earlier stages of our presentation. And we want these policymakers to be thinking about how do we support the mental health and wellness of young people of color at the federal and at the state and at the local level. So we're really thinking about changing and shifting political will at all levels of government. You can go to the next slide. And so the next slide is about what's next for our work in this. So we were a collective that came together for the duration of this project. We are not working on projects together at this point in time. However, we're all continuing to do this work. So I'm going to run through a few examples of how some of the organizations that were part of the H3 collective are continuing the work that we started together. I also just want to say that while we're not all working on joint projects right now, we are still very much engaged and sharing information and really trying to support each other in our respective projects. So at the National Black Women's Justice Institute, we really have responded to the call to improve school-based mental health services. And so at our organization, we have launched an initiative that we call CARES, which is creating affirming, responsive, and equitable schools. The whole intention of the CARES initiative is to build the capacity of school leaders, school educators, to be able to support the mental health and wellness of Black girls and gender-expansive youth, in particular, in the understanding the ways in which they have not had the same kind of support, and that, as Dayanara explained, that the current mental health system really is not equipped to support these young folks. And we have seen that as a result of kind of the limitations of mental health services in schools, that we see Black girls and gender-expansive youth and other young people who are impacted by the juvenile legal system, and that the school to prison pipeline, we believe at the National Black Women's Justice Institute, could be really reduced significantly and even eradicated if we were able to support the mental health and wellness of young people in schools, because so many of the behaviors that are perceived as problematic are treated with discipline rather than with healing-centered responses. So our work is really focused on how do we build the capacity of schools to support young people rather than punish and discipline them and push them out of schools. One of our partners, Justice for Girls, has been trying to get legislation in Washington state passed, even trying to have they proposed a budget proviso whereby they're trying to seek additional funding to support the Girls Advocacy and Impact Network that they run, as well as garner additional funds for their girl-centered anti-bias training for public systems caregivers. They have drafted policy outlining 3 recommendations, the first being to improve and expand improve and expand prevention, diversion, and discharge services for girls who are involved in the juvenile legal system in Washington state or are at risk, as well as promote safe and inclusive school communities for girls and gender-expansive youth, and also to address the mental health crisis that is impacting girls, and that it needs to be girl-centered and it needs to have a racial equity lens. So they've also, which is not on here, they've just released a training tool that you can find on their website to help folks better understand the needs of girls who are impacted by the juvenile legal system and to support their advocacy. We've also worked with Detroit Heals Detroit. Please ignore the typo on the slide, but they have just recently opened their doors to a youth-led healing hub, and that, they have not. They will actually later this month be opening their doors to a youth-led healing hub, and it's a community-funded project. And in this space, it will amplify culturally rooted trauma-informed care, providing wraparound services, and really use a transformative justice model to help students who are experiencing trauma, particularly young people who are ages 12 to 21. And then on the next slide, you'll see that we have also been working with Las Fotos project. There it is. I let the slides catch up to me. And Las Fotos project has really been investing in training the mentors that they connect their young people with, so that their mentors are better equipped to support the mental health and wellness of the young people they serve. They are also really thinking about how the people on their team can do a better job of supporting the mental health of young people, especially young people who are in crisis. And they have done so by creating and establishing guidelines around safety planning, as well as what to do if there is a safety event. And they're really trying to think intentionally about how they, as a staff, can do better to support the mental health and wellness, which I also really love. While we all may be really committed to the mental health and wellness of young people, there still remains a lot for us to learn and a lot of reflection for us to engage in regarding how we can do that better. And I think this work has really helped all of us think very intentionally about what that can look like. And then I'm going to pass it back to Dayanara, who can tell you about the great work that the Children's Partnership is leading in California and the great accomplishments they've had recently.
Thank you, Sydney. So the Children's Partnership, we have also been adopting some of our policy recommendations and trying to implement them in California. So the one of the big ones is that the Children's Partnership will actually be spearheading California's first peer-to-peer mental health support pilot program. This came up a lot in our H3 collective and how youth want to be able to provide peer-to-peer support. So the Children's Partnership will actually be the grant administrator for the pilot program. We will be selecting high schools across the state, which will be provided with funding and technical assistance to create their own peer-to-peer mental health support programs. We will also be using the pilot program to be gathering data on best practices, which we will then submit it to the state legislator as part of our advocacy to continue to increase high school peer support programs across all of California. So this is a pilot program. We just hired our director for the project, so we're very excited to get wheels down. And the second thing we're leading on is we are co-sponsoring a piece of legislation. So the bill is called AB 665. It's through the state legislature and through the assembly side. But this bill would actually grant minors between the ages of 12 to 17 that are enrolled in Medi-Cal, so our California Medicaid program, to be able to consent for mental health services. Currently, youth that are enrolled on Medi-Cal are not allowed to consent for these services. However, youth in California that are enrolled in a private health insurance plan are. And excuse the typo on the insurance. But we want California to be equitable, and we want all youth to have access to be able to consent for their mental health services if they're in the middle of a crisis and they need to speak to somebody. We know that youth that are on private health insurances have that right and that entitlement, and we believe that youth on Medi-Cal should. And we also know that Medi-Cal serves some of our marginalized communities, our low-income communities, and we want all communities, regardless of socioeconomic background and race, and that to be able to have these entitlements that others already have in California. So we're trying to work on that right now. Those are two of our projects, and we hope we just can't wait to see how all of this turns out and to better further youth mental health in California. We will open it up now for questions. We know that we've been speaking to you all for a bit. We've been giving you a lot of information, and really we want you all to be able to use this space to ask us any questions about anything we said, about the experiences. Samantha's still on, so if you have any questions for her as to what it was like to be in the Hope Healing and Health Collective, please let us know. We know that the Q&A function is available, so any questions that are dropped in that, we will be answering them live. And while you are all typing questions, we will also just use this time to share that we have, and so this slide deck is in the resources page for the conference. So you all actually have access to the slide deck, but at the end of our slide deck is actually a lot of health and mental health resources that we have collected throughout our project and our time working together. So we have a plethora of resources, and we wanted to make sure that we also had resources that were specific to some of the communities we were working with. So we have resources for a lot of different needs, and we want everybody to be able to access this. So we wanted to just flag this now, let you all know that this is all available, and we hope it is useful and helpful for all of you. I saw a question pop up, but I missed it.
It's asking where the slides will be available. I think that should be available on the resources tab. And also, I'm not sure if it's going to be distributed by the summit, but I'll check on that. Any other questions?
Seeing that we're not having any questions, we're actually gonna let you guys have some more time back. Thank you all very much for sticking with us for this conversation. Thank you for having us. There's contact information here. I will stop sharing, and then Sydney or Samantha, if there's any final things you'd like to say.
I just want to say thank you so much for allowing us to share about this work that we've done together. And I also very much always appreciate being in space with the two of you. It is always really wonderful to talk about this project because I know it's really impacted all of our work pretty significantly. So thank you all for the opportunity to be able to share that with you all.
Yes, I just want to say thank you for having me. It's been really wonderful just rehearing about the work that we've done, and I'm really grateful to just meet up and talk with you guys today.
And if you haven't already, I hope you check out the amazing, beautiful report that is quite extensive that I think we're all very proud of. Are we looking for partners? Always.
Always.
Always. I think for both of our organizations, we really thrive on partnership, and partnership was so important to this work. Really, we couldn't have done it without our partners. And so I think, if you are looking to do more work around the mental health of BIPOC youth, please reach out. Yes, we can put our contact information in the chat, but please reach out, because this is work that we are continuing to do.
I just dropped in my email, and I know our contact information is at the end of the slide deck, and you all should be able to see it in the resources for the conference, and in that is also the report. So you should all be able to access that. And then I know, Barbara, you had you wanted to hear more about the peer-to-peer initiative. If you want more information, you can feel free to email me and we can get some questions answered for you. Thank you. All right. Anything else? If not, we will pass it back to you, Robin. Thank you so much for having us.
It looks like there's a question from Karen Johnson about how it says you are a mobile crisis screener and often see many clients and able to get follow-up services and eventually are back in crisis. How can we better engage with this population and their parents to promote the importance of mental health? I think it's a great question, and I think one of the most important things that we've learned in our work together, and please, Dayanara and Samantha, please jump in. But I think one of the most important things that we learned is that education is really important. And we heard from young people that, culturally, mental health was not always prioritized. And so that there is, in order for, I think, young people to feel comfortable addressing it and to feel supported by the adults and their caregivers in their lives to seek support, there needs to be some more education around what it is, what are the different kind of mental health modalities. I think also the extent to which, as Dayanara mentioned, we can connect young people to resources that are not clinical, that are even youth development and organizing focused. Is really very, very helpful. But I think the way that we can really support young people getting access is really by helping to educate their parents about the importance and introducing them to the different resources that are available to them. Dayanara, Samantha, anything you want to add?
I think you hit it on right on the dot. That is very much what we heard time and time again. It's making sure that not just the youth or the person that's in crisis has knowledge of what's going, all of the resources available to them, but also their family and their peers. It really is. Health education isn't just for the person that's being impacted. It should be for everybody. And going back to some of the entitlements and the health insurance benefits, those are conversations that a lot of people don't get the privilege of having or understanding. What are you entitled to? What are your rights as a patient? And those are very important to also share as well.
I would just say I agree with what Dayanara said. I think there's a lack of knowledge of what are my rights, and then I don't think schools do a good job teaching that. I also think that there could be a fear of going to your parent and asking to have mental health resources, and that could just be internally or externally they advocate against mental health care or reform. But I think having mentors, positive mentors, journaling, stuff like that, if you just tell them about those positive mental health activities that they can do, and just like learning to spend time like loving yourself, that can be another method to prevent them to go back into crisis.
Thank you, Samantha. Anything else?
Oh, I was just saying, and the screen's dropped away from me for a second, so I don't know if anyone heard me. But I was, okay, no worries. I was just going to say, I think the other thing to acknowledge, it's important for us to acknowledge the poor experiences that people of color have had with the medical and mental health system. And I think that we have to just really be real about what those challenges, barriers, and where the mistrust comes from. And we have to also then really transform our system. As we said earlier, we need folks of color who look like our communities doing this mental health and wellness work. And I think that is will be transformative for engagement for young people and their families, and really getting the support that they need when they are in crisis. And more importantly, when they're just trying to be their best selves all the time. Like, mental health services aren't always about when you're in crisis, are just about supporting your wellness always.
All right. I don't see any more questions. So I think with that said, thank you to our speakers today, Dayanira, Sydney, and Samantha. Thank you for sharing your time, your experience, and expertise with us today. Their contact info is on the chat, if you guys would like to note that down. For those of you who attended, thank you for being here. Please take 30 seconds to click on the survey and respond to a few questions. It's next to the last icon, the vertical navigation bar that looks like a checklist. Between now and then, we invite you to take a few minutes for a break and to explore the many resources available for your platform. On the landing page, with all the gears, you can click booths and see a number of pre-recorded short lightning talks. You also have the opportunity to virtually scroll by some booths and learn a little bit about all of the partners of NTTAC. The resource tabs provides a variety of one-pagers, PDFs, and PowerPoints, all available for free and ready for you to download. Thank you again for being here, and we'll see you at the top of the hour for today's closing note.
Thank you.
Thank you,
everyone.